sales and marketing are over here, like you said, sitting in their silo saying, we can't do anything. Nobody lets us do anything. And legal and compliance are over here saying they just want to get away with things and push the boundaries, right? So the companies that do it well, they're talking. There's no silos. It's compliance understands what sales is trying to accomplish. Sales and marketing understand why the boundaries are there. But if you're sitting in your silos and you're not having those conversations, it's going to go nowhere.
Welcome to the Medical Sales Accelerator Podcast. I'm your host, Zed Williamson. I want you to think of a time where you've had an idea that you know would drive your sales and potentially even help your customers grow. But someone in your organization had already made a decision. Nope, it's impossible. It can't be done. And that's why we're speaking with our guest today, Erin Pellid, Managing Director with Trackable Med. Erin, thank you so much for joining us today.
Well, thank you for having me.
Absolutely. So we are dipping our toes in the conversation around compliance. And that's what I was hinting towards in the intro. But compliance can mean so many things to so many different people, and sometimes can feel like a headwind that sales has to battle.
Absolutely. Sometimes it's like the dirty word is compliance when you start talking about different marketing programs or initiatives that you are working towards, to your point earlier, that you know are going to drive the business, right? So yes, it can often be thought of as a negative instead of a positive.
And what I've seen with organizations is sometimes this kind of throw up my arms, throw up my hands, and say, okay, well, I guess we just can't do anything. What have you witnessed in your career regarding compliance, and when there's times where you can actually do something and compliance isn't a bad word?
Yeah, I feel like I've seen it go both ways, right? I've seen it done incredibly well where you're working together with compliance and it's this perfect scenario of we're working together, but also setting the right boundaries to protect everyone. And I've also seen it go terribly, where again, you're either throwing up your hands and saying, screw it, I'm not going to take the time to even attempt this, because you probably don't understand the process, or you're not following compliance rules at all, and then you're in a whole nother ballgame of trouble as well. So again, I've seen it going really well, and I've seen it gone really terribly in my
Yeah.
career.
Well, and it's tough because if you put yourself in the shoes of the compliance team,
Mhm.
their job is protection.
Yeah.
And on many, many podcasts, you'll hear me talk about how our brain is wired for safety. We are wired to avoid pain, avoid death, avoid harm. And so
Yeah.
here you take a group of humans and you put them in a role where they're actually like they are supposed to do that. It's very easy for that group of people to get into an automatic no mode. And I am a big fan of compliance. It is a required, necessary thing so that people are protected. Um, and there's ways to do it right.
Yeah. And I think that mindset also goes in the way of physicians and practices as well. So again, if you can do it the right way and work with compliance, it can actually work to your advantage because the practice, maybe it's a larger system, is probably worried as well about compliance. And if you can come to them with, hey, we have this thing, but guess what? We already did the due diligence of setting this up in a compliant way. It makes it so much easier for them to say yes and for you to be the hero with them, right? So yeah, I think that drive to protect ourselves, yes, internally within your company is happening, but also externally is the same thing is going on with your customer, right?
Yeah, absolutely. And I think there's the important thing to recognize is in these big organizations, it can feel stressful.
Mhm.
Sales has these goals laid out in front of them. And sometimes they can feel like the rest of the organization kind of keeps moving the finish line or throwing barriers up in front of your race, like they're adding hurdles to your dash, right? And sometimes it drives this internal behavior of nothing can be done, so we're not even going to try. We're not even going to get close to trying. We're just going to ignore the potential completely.
Yeah. Yeah. And I think I think it's spoken a lot about like sales and marketing within organizations of kind of two silos existing, right? But I think compliance is almost this third silo, if you will, that we don't talk enough about. That if you can work together, sales, marketing, and compliance, like not only is it easier, but you have that much more impact. And in many organizations, not all, but the ones that aren't doing it well, it's this sales and marketing are over here, like you said, sitting in their silo saying, we can't do anything. Nobody lets us do anything. And legal and compliance are over here saying they just want to get away with things and push the boundaries, right? So the companies that do it well, they're talking. There's no silos. It's compliance understands what sales is trying to accomplish. Sales and marketing understand why the boundaries are there. But if you're sitting in your silos and you're not having those conversations, it's going to go nowhere. And the cool thing about what my role and our role is like we get to work to make those connections happen and be this kind of neutral middle party where we're like, okay, we have both sides here. Let's bring everybody together to make something that makes sense.
I've seen that scenario play out where you've had experience in marketing programs that are compliant,
Mhm.
talking to someone who has never done anything close to it. So they're coming at it from this angle of they really are just kind of scared. And so there's been so much value in kind of the I've been there, we've done that. You know, we are compliant facing, like we are openly like, yes, let's be compliant in the tactics that we use.
Yeah, that's again another just aspect of why I love this role I'm in, that I get to take what I learned when I was in med device world and building out programs like this and now share it with others and get them to change that mindset of like, this is impossible. We can't do this. We're going to get told no. And I get to kind of work hand in hand and say, you don't have to be told no. There are guidelines that are there to protect you and your customer, but there's like very simple ways to do so many things that if you just change your mindset and find a way to, again, work with and not against each other, the programs, I mean, as you've seen for many, many years, are so impactful. It's worth the time spent for sure.
Yeah, and the they're impactful because they're affecting patients. I mean, that's the kind of the big picture here
Yeah.
is we live in this world where patients are unaware.
Mm.
Um, they are needlessly suffering with whatever they're suffering with. And when industry and practices can come together and be this resource for patients to understand what's actually possible for their lives, there's so much power in that. And
Absolutely.
I've seen so many times the exact scenario you described where a company, like the idea of co-marketing is almost laughable
Mhm.
because it's a complete impossibility. And it's it's really been satisfying seeing you work with a company that maybe has that mindset to start with and then realizing, wait a second, this is doable. And hey, wait a second, it's benefiting everybody.
Yeah. And I feel like once you start to build a program, right, and you've seen the teams work together and compliance says, hey, this is okay. And yes, sales and marketing are going to follow these guidelines, then it's like doors just start opening because everyone trusts each other and they know, again, the intent is we're just trying to get this information in front of more patients and we're going to do it the right way. And I just love that you touched on that, it being about patients, because truly, too, if you remember it from that perspective, compliance in the med device world and in the practice world is to protect patients, right? Like we want to make sure they're getting the correct information, that nobody is doing things for reasons that they shouldn't be, financially, all of those things. So if you start thinking about it again from that perspective of patient first, I think that helps change your mindset as well on this isn't like a thing to hold you back from selling. It's to protect everyone involved. So yeah, I love that.
What would you say is maybe something you remember um, someone working in medical device being surprised about what can be done or regarding co-marketing?
I think co-marketing specifically is something where people are shocked that there can be both parties paying equally from a compliance perspective and also just from a customer saying yes. I think it's scary to go ask doctors to do some of these things or ask practices in general. Um, But I think just setting that up, it seems so overwhelming, right? It seems like this big mountain we're trying to climb of getting everything approved and every, you know, T crossed and I dotted. And once you start down the process, it's really simple of usually using approved materials, using, if you're working with us, what we already know is compliant. And again, like having those very open conversations team to team, that it becomes much less scary once you start the process.
And that's the key is to just start. I mean, there's so many ways for organizations to help patients get out of the pain they're dealing with. And it seems like the industry puts a little bit too many barriers in front of itself in getting to that patient.
Definitely. And again, it's just a mindset of we can't do this, we can't do this, we think we can't do this, or we think we're going to get told no, so we don't ask.
Right.
So changing that perspective is just going to make all the difference.
Because it's a common goal, right? Everyone believes one thing and we can all put our oars in the water at the same time and really get there. Well, Aaron, I really appreciate you taking the time and spending it with us today. If someone wants to reach out to you, is it okay if they connect with you on LinkedIn?
LinkedIn, you should be able to find my information also on the Medical Sales Accelerator website. So either way, reach out. I'm happy to chat more in detail about these things with whoever's interested.
Excellent. We'll put all the links in the show notes as well for easy access. Thanks again. Make it a great week, everybody.